Hi all, welcome back to my channel. I hope you guys are doing good. Today I am going to discuss about a common and a simple disease condition, that is diabetes mellitus, commonly known as high blood sugar. Let's move on to the topic. Diabetes mellitus is a condition where the blood sugar is too high. In this slide, we can see the normal body mechanism which controls the blood sugar. So, insulin is a hormone produced by pancreas. You can see the pancreas in the picture, which helps the glucose in our body to enter into our cells. So, whenever glucose enters your bloodstream, the pancreas will produce enough insulin so the glucose can get into your cell. So, the blood sugar will be maintained normally. So what will happen if you have diabetes? This mechanism does not work. Now you got a clear idea that insulin plays an important role in controlling the blood sugar. So the main reason behind the high blood sugar is, the first one is when your body cannot produce any insulin. That means if pancreas is not at all producing any insulin, it will end up in high blood sugar. The second reason is insulin, which is produced by your body, is not effective. Here, the pancreas is producing enough insulin, but whatever insulin it produces is not effectively utilized by the body. The third reason is when your body does not produce enough insulin. Here, pancreas is producing some insulin which is not sufficient for the body. So these are all the main reasons which will end up in high blood sugar. Now you know the reason why the blood sugar is always high. So the first reason is when pancreas is not at all producing any insulin. The second reason is pancreas is producing insulin but that is not effective. The third reason is pancreas is producing only small amount, that is not sufficient for the body to control the blood sugar. So based on these reasons, it's been divided into two types. Type 1 diabetes mellitus or insulin dependent diabetes mellitus and type 2 diabetes mellitus. There are some other types, but I just want to insist these two types in order to make you understand easily. So type 1 diabetes mellitus, here the blood sugar is too high because your body cannot make insulin. So the reason here is the pancreas is not at all producing any insulin. So the only way is we have to give some insulin in order to control the blood sugar. That is the reason why it is otherwise known as insulin dependent diabetes mellitus. And here the type 2 diabetes mellitus, the blood sugar is too high because the produced insulin is not effective or insufficient. Let's discuss about the signs and symptoms of diabetes mellitus. You have to keep the 3 P's in your mind. The first one is polyphagia, second one is polyuria, and the third one is polydipsia. Polyphagia means excessive hunger. So here the blood is with more sugar. Due to the absence of insulin, it is not entering inside the cells in order to convert into energy. So the person will be always in excessive hunger. The second one is polyuria, that is excessive urination. Here, the kidney will produce more urine in order to flush out more sugar in the blood. As a result, it will end up in polyuria. The last one is polydipsia, that is excessive thirst. So the kidney started to produce more urine. So more water is losing from our body. In order to compensate that, the people will be always in excessive thirst. So these are all the main signs and symptoms of diabetes mellitus. It's always important to know some terms when we are taking care of diabetes patients. So the first one is RBS, random blood sugar. So here we are testing the blood sugar at any time, irrespective of fasting or the patient had food. So the random blood sugar will be always less than 125 mg per deciliter. The second one is FBS, that is fasting blood sugar. Here we are testing the blood sugar after 8 to 12 hours of fasting, that is in the early morning. So it ranges between 70 to 100 mg per deciliter. The third one is PPG, that is postprandial glucose. So postprandial glucose means after taking food. So whenever doctors are advising us to check the postprandial blood sugar, the ideal time to check is 2 hours after a meal. So the normal will be between 120 to 140 mg per deciliter. So these are all the three terms we should know. RBS, random blood sugar, FBS, fasting blood sugar, and PPG, postprandial blood sugar. Let's see the normal blood sugar range. In fasting, for normal person, the blood sugar is between 70 to 100 mg per deciliter, and for diabetes, it will be 126 mg per deciliter and above. After eating, soon after eating, for a normal person, the blood sugar is between 170 to 200 mg per deciliter. For diabetic patient, the blood sugar ranges between 220 to 300 mg per deciliter. 2 to 3 hours after eating, that is postprandial. For a normal person, it ranges between 120 to 140 mg per deciliter, and for diabetic, it is 200 mg per deciliter and above. Let's have a quick look on treatment. So type 1 diabetes mellitus, which is also known as insulin-dependent diabetes mellitus, can be managed by administering insulin, insulin pump, and medications. Type 2 diabetes mellitus can be managed by following diet and doing regular exercise. Thank you so much for watching this video. Even though the topic is too big, I made it too short in order to make you understand easily. I hope this would be helpful for you guys. If you feel the same, kindly like, share this to our friends and subscribe my channel. My channel name is Chebin Shine. Don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Once again, thank you all. See you all again with one more interesting topic. Until then, it's bye from Chebin. Bye bye. Take care.